I want to remind the viewers that are just joining us that we're trying to destigmatize male enhancement and ask that you like and share. I want you to actually go out there and listen to us on our podcast because we're on all platforms now. You can also go to our YouTube channel. Please make sure you've joined us there. Also, you can catch us on all the other social medias like Instagram, TikTok, stuff like that. We're out there on all of them. So now, these are true conversations where I'm trying to break all this information down, and I'm giving you information that you're not gonna get sitting in front of your urologist. Why? Because they just ain't got time to talk to everybody individually. And because I'm a urologist for over 20 years, I can put it out there and take my time. So today, let's talk about something we're seeing more and more. Men in their 20s and 30s are struggling with erectile dysfunction. And no, it's not just in their head, and it's not normal. So we're starting to see more and more guys who are younger who are having problems with erectile dysfunction. ED is no longer just a middle aged man's problem. Actually, the reason might surprise you what's really going on. The thing is that, we've always kind of thought of erectile dysfunction being an old man's problem. The new reality is that younger men are presenting more frequently. This isn't, it's not rare anymore. I mean, we're seeing this all the time. Young guys are coming in saying that they're having problems with erectile dysfunction. They're having to get on medications earlier, than they should. The question is why? Why is this happening? What's going on here in America? What's happening? Because we're not quite seeing the same trend in other countries, but what we're talking about is the trend right here in the United States. All right, now, what are some of the top causes? Let's try to break some of this down. There's this whole thing where they talk about, uh, porn induced desensitization, overstimulation, unrealistic expectations, reduced response to real life situations. Your brain adapts to the intensity, and in real life, you just can't compete. So that's part of some of the things that you would expect me to say. They watching all this porn and they getting themselves all hyped up, and now when it comes down to really performing, that's becoming an issue. Well, some of that's true, and then this whole thing with performance anxiety and pressure, because you got things going on out there in social media, you got the comparison, the fear of failure, and the sympathetic response that goes along with it. And let's not forget about this whole thing about, poor metabolic health. That's fast sugar, fast food, sedentary lifestyle, and it all leads to this whole thing of insulin resistance. And then number four would be like the whole thing with stress, sleep deprivation, lifestyle, late night screen, being on your cell phone, poor recovery, and all that stuff impacts your testosterone because it drops, and your recovery is repaired, and your libido and performance suffers. Now, I'm gonna get a little bit deeper. All right, we're gonna jump onto this whole thing a little bit deeper. Uh, the increase in erectile dysfunction among younger men appears to be real, although estimates vary depending on the studies. Historically, ED was considered primarily a disease of aging men with diabetes, vascular disease. Today, many urologists report seeing substantially more men in their 20s and 30s that are seeking treatment. So we got more guys coming to us now as a urologist, and I'm a urologist. More guys are coming to us at an earlier age because they're having problems with their erections. So let's talk about this whole thing with metabolic and insulin resistance because that's one of the most important things that we see. All right. Young men today have higher rates of obesity, pre-diabetes, type 2 diabetes. That's once you get full-blown diabetes. A lot of guys be like, oh, I'm good, I ain't got diabetes, but my doctor told me I need to eat better because I'm pre-diabetic. Well, at that point, the damage is already starting to happen. You're just not a full-blown diabetic type 2, all right? But it's already starting to happen. Metabolic syndrome, fatty liver disease. Basically, when this is starting to happen and you are pre-diabetic, you're already starting to deal with this whole thing of insulin resistance, which damages the endothelial tissue. And the endothelial tissue is what makes up the lining of the vessels. And the vessels is what everything goes through. So when your doctor is telling you that you're pre-diabetic, all right, that you don't have it, we're not putting you on medications yet, understand damage is already being done. You say, well, what do you mean? Well, this whole thing with insulin resistance, think about it like this. I'm trying to simplify this whole thing. Is that when you're eating and your body's breaking it down, your blood sugar goes up. You're breaking down the carbs, or if you're eating sugar and candy and all this other kind of stuff. And then insulin is released because what it's trying to do is take that sugar and force it into the blood the blood cells, not the blood cells, into the cells themselves, the endothelial cells, the cells that make up the body, because that's where the energy comes from. All right, so the problem becomes over time, from all that insulin stimulation, from all that sugar that's in your bloodstream, the cells become resistant. It's kind of like having a door, but I can't unlock it anymore. I gotta get the energy into the room to keep the body working, but my key doesn't work anymore. Why? Because the cell now has become insulin resistant. So then when you take all these medications, that they put you on out there because you're a diabetic, like metformin and whatever, it's trying to get rid of all the sugar that's in the hallway. But it does nothing to unlock the door to get sugar into the cell itself that needs the energy. Are you following what I'm saying? So metformin doesn't fix the problem of insulin resistance. What it does is get your blood sugars down. So indirectly, it's trying to help out because of all these high blood sugars. But you've already had injury because of your insulin resistance. And insulin resistance ties directly to nitric oxide release. And what does nitric oxide do? It dilates up the vessels. Now, so let's talk about the normal pathway that happens. All right, so you get sexual stimulation, nitric oxide is released, you get increased cyclic GMP, smooth muscle relaxation, increased blood flow, venous trapping. Hey, now I got an erection. That's how it's supposed to work. But insulin resistance interferes at the nitric oxide level. So you're not going to get that dilation. You're not going to get the good blood trapping. And you're going to say, hey, doc, I've noticed that I can get an erection, but they're not as hard as they used to be. Well, damage is being done. All right. So as a result, ED may develop years before you actually get a heart attack or stroke. Many experts consider ED an early marker of vascular disease. So actually, this could be an early onset that, hey, something is really going on. All right. Now, this whole thing about pornography. All right. Pornography induces sexual dysfunction. And this is one of the most discussed causes among young men. All right. So now, the theory is that you get frequent exposure, because you're staying up at night and you're watching all this stuff, and you're highly stimulated online and you're doing the pornography thing. And when that happens, remember we talked about dopamine, that neurotransmitter, all right, that feel good that you get, so we love dopamine. You get dopamine rush just from hitting a golf ball real well, or, if you're bowling and you bowl a strike, that's a dopamine surge. Like, yeah. So the same thing happens during sexual intercourse, but you're getting overstimulated because you're over there watching porn and you're doing what you're doing, and your dopamine is surging, and man, you're loving it, you're having a good time, and next thing you know, I'm addicted to porn. Why you're addicted? Because you're addicted to the dopamine rush that you get when you're watching porn. But what happens is you get desensitized through those pathways, and then you reduce response to the normal sexual stimuli. So I'm so desensitized because I've been freaking out on this dopamine that I'm getting when I'm watching porn. Then when it's actually time to actually have sexual intercourse, you can't reach that level. So strong erections during pornography, and then weak erections with your partner. Delayed ejaculation. You get less libido for real world sexual encounters. I'm just not stimulated as much because she ain't doing what I was watching when I was doing porn. So the scientific evidence is really mixed, but many sexual medicine specialists recognize this clinically, that you can overstimulate yourself. And now the thing is that in real life situations, you're not performing because you're so dopamine overloaded from porn. That's the whole thing that, a lot of people are looking at. Now, what's another thing? Low physical activity. All right. Many young men, they sit all day. All right. It's part of our lifestyle. We work remotely. We're on our laptops and whatever. We don't exercise as much as we do. Right now we're trying to get people to get their steps in. I need to get my steps in. I need to get out. Yeah, you do. You need to get your steps in, because we need people to be more active. But that's one of the problems that happen. Kids aren't playing outside anymore. They're sitting there, on their gaming and all this other kind of stuff. They're not getting the exercise that they used to have. And that leads to poor cardiovascular fitness. Yeah, that's why you're a fat boy. You're a fat boy because you sit there and you play on games all day. You're not out there playing soccer or basketball or baseball. You need to be active. And that's one of the things that lead to the problems later on down the line. So regular exercise will increase your nitric oxide. What does nitric oxide do? It helps blood vessels relax. Regular exercise will increase your testosterone sensitivity. Regular exercise will increase the endothelial function of the blood vessels themselves. All right. And then if you do all of that, regular exercise increases your blood flow. So regular exercise is important. So yeah, you got to get up and get out and start doing stuff. So even a few months of aerobic exercise can significantly improve your erectile function. So it's good to exercise. Exercise increase your blood flow, and if blood is flowing, then you get better erections. Now, what's another factor? Another factor that we see is poor sleep and sleep apnea. All right. So sleep is when men produce the most testosterone. So you gotta sleep. Poor sleep causes reduced testosterone. It increases your cortisol levels. It increases your insulin resistance. So poor sleep works against you. Now, if you're a guy out there and you're snoring all the time, then recognize you may have some sleep apnea. And if you got sleep apnea, you're not relaxing. If you're not relaxing, then your body's not producing the testosterone that it should and all because it needs to rest. So sleep apnea works against you. The increase in erectile dysfunction amongst younger men under 40 appears to be real. Although estimates may vary depending on the study, historically, ED was considered primarily a disease of aging, diabetes, vascular disease. Today, many urologists report seeing substantially more men in their 20s and 30s that are seeking treatment. All right, now we know this cause is multifactorial. All right, so this whole thing with metabolic disease and stuff like that, all that kind of goes together. Now, I can tell you that this whole thing is sleeping. Guys, one of the most important things that you can see as a man is when you wake up with a heart on. That nocturnal erection, that friend that you see in the morning, that is so important because that means that I got good blood flow, good nerves, and good desire. Nocturnal erections are very important. And if you're waking up every morning with a heart on, that is super important because that tells you that your body is functioning correctly. All right, when you start noticing that your nocturnal erections or that morning hard on that you have is falling off, then that means that there's some changes going on. All right, so know this, that hey, nocturnal erections are important. All right, and you gotta, that's a good barometer to tell you how well things are working. All right, here's another point that we need to talk about: anxiety and performance pressure. All right. This may be the leading cause of ED in most guys in their 30s. Why? Because we're not as socialized as well as we are. Too many guys are spending so much time on their cell phones, on social media and all this other kind of stuff. So they get these common triggers, the fear of failure. All right. When I'm dealing with a new partner, relationship stress because you don't even know how to talk to her no more because you're so caught up on what you do on your phone. Just that interaction has gone down. Social media comparison. I ain't getting enough likes, so I don't think I'm as popular, and then these pornographic expectations. Once a man experiences one episode of erectile dysfunction, he worries about recurrence. Like, oh my God, is that going to happen to me again? It didn't get hard, you know? And then once he worries about that, adrenaline rises. And then once that happens, then the sympathetic side of the autonomic nervous system starts to take over. And the penile arteries will constrict. And then that ED that you're having, it becomes self-reinforcing, meaning it gets worse and worse and worse. Many young men have perfectly normal vascular systems, but cannot achieve erections because of excessive sympathetic tone. It's really in their head. That's that psychogenic erectile dysfunction that I was talking about. Now, what about declining testosterone levels? The average testosterone levels have declined over the last several decades. Guys are starting to notice a drop off by age 35. I was telling you after age 35, some guys are dropping 1 to 2% every year. Now, everybody doesn't drop at the same rate, but that means that by the time you get into your 50s and 60s, some guys are really having to have testosterone replacement because they've dropped off so much. All right. So the thing is that what are the possible things that contribute to that? Obesity. All right. Once again, being overweight works against you. All right. So, and that really comes down to how you're eating. Another thing is poor sleep. Like the whole thing we talked about with sleep apnea. And it rolls on itself. Because I'm obese, I lay in the flat position and everything falls. I got a big fat neck, and now I'm obstructing, and now I'm snoring. And because I'm snoring, I don't really rest. All right? And because I don't really rest, my testosterone levels are dropping, and my energy level is dropping, and I'm starting to develop diabetes. Being overweight really works against you. All right, so then you got these endocrine disrupting chemicals out there, you know, and that's why certain things that you can eat can work against you. Did you know eating too much soy can actually work against your testosterone levels? So that's something you should look up. What are the foods out there that actually decrease testosterone? Soy is one of them. Sedentary lifestyle. You're sitting on your butt. You ain't getting up doing nothing. You're not increasing that blood flow through your body, but all of a sudden you want it to flow through your penis. Not going to happen. Not going to happen. Why? Because you're not doing anything to increase your blood flow. You need to stay active. And then the last thing is this whole thing with just chronic stress. These young dudes are stressed out much more than the previous generation. So while testosterone is not the most common cause of ED in young men, it contributes to decreased libido and reduce erectile quality. Now, what about medications? Medications can affect you too. You know, we got all these SSRIs out there. Those are the anxiety medications, finasteride, dutasteride, some blood pressure medications. You know, you got high blood pressure. We got to get the pressure down. But the penis likes all the pressure it can get. The antipsychotic medications. And then on top of that, just straight up recreational drugs. Dude, let me be clear. Cocaine constricts vessels. Hey, if you're getting high, it's constricting those vessels. And eventually you're going to start noticing that if you're a cocaine abuser, you're going to have problems with your erections. There you go. I said it. Yep, sure did. That goes right along with other things that constrict your vessels, you know, like nicotine. All right. So, marijuana may also contribute in some men, but there's some mixed data out there about marijuana. You know, so I can't quite say if marijuana is doing all of that, but I know marijuana can keep you in a relaxed state, which helps out more with, dilation of vessels with the parasympathetic system. But I am not promoting marijuana smoking. I'm just saying there's mixed data when it comes to marijuana. All right. Then let's talk about this whole thing about vaping and nicotine. All right. Many young men do not smoke cigarettes. Cigarettes are not as popular as it used to be with the earlier generation. But now what they did, because, they were so about don't smoke, now they made it cute. Now everybody's vaping. But if you pay attention, the vape has nicotine in it also. So that's how they get you. They get you with the nicotine vapes, the disposable e-cigarettes, and the nicotine pouches. So now you're not smoking like you used to, or like we used to, but you're vaping. So they still got you. Still got you. You're still going to have the same problems. So nicotine causes vasoconstriction, endothelial dysfunction, reduced nitric oxide availability. All right? So the nicotine is working against you. The penis is particularly sensitive because penile arteries are small. The penis arteries are very small. So they're the first ones that notice the difference. All right? That's why your erections are some of the first things that happen. Now, let's talk about chronic stress. All right? So one of the stressors that we're seeing out there is financial pressure. Our economy right now is going down the drain. And financial pressures. There are more younger people living at home now than ever before. So they got financial stresses. The whole thing of getting out there, getting a house and all this other kind, that is unreachable for some people. They're having to move back home. You know it's real. You know I'm talking to you. You know you live with your mom and daddy. But it's because you got to. Things are tight. And then you're at home and you're dealing with the social media and all this other kind of stuff. It's stressful. It's stressful being a young man, especially when you can't get out there on your own. Hell, you're 24, 25 years old. You're still in mom and daddy's house and they ain't letting you do what a 24, 25-year-old would do. All right? So your career is uncertain, and then you're dealing with this constant digital stimulation. So things are different now in this year of 2026, and they don't look like they're getting any better. Man, I didn't know all this stuff was affecting my erections. Yeah, boy, it is. Chronic cortisol elevation is what you get with stress, and it can lower your testosterone. It can increase your insulin resistance and increase that sympathetic nervous system pathway of the autonomic nervous system that keeps you from getting erections because you're stressed out. All this will impair your erections. Now, cardiovascular disease appears earlier now than what we've ever seen before. Many men in their 30s now have high blood pressure, they're pre-diabetic, they got increased lipids, all right? because they got to get on cholesterol medications and all, and they're fat, because they're not exercising. The penile arteries are about 1 to 2 millimeters compared to 3 to 4 millimeters in the heart. Did you realize that the penis has smaller arteries than the heart itself? That's why I always tell you, the penis is the barometer. If you're having problems, he gonna tell you. He's the first one to tell you, I'm having problems. All right? You better pay attention. Because they are smaller, the penile arteries often show symptoms first. ED may precede coronary artery disease 3 to 5 years. So, the thing is that the penis is telling you earlier that you got a problem before you have a heart attack 5 years from now. You can live without erection. You can call that a penis attack, but you can't live through a heart attack if it's a major heart attack. Like the left anterior descending, you're knocking that out, you're gone. That's a widowmaker. So, now, what do we see as the major drivers that are causing this thing? If I had to rank the most important causes of the rise in erectile dysfunction in younger men, I probably would put it in this order: insulin resistance and metabolic syndrome. All right? So guys, if you're pre-diabetic, if you're already developing insulin resistance, if diabetes runs in your family, I'm not a diabetic, but they're telling me, hey, I need to control my diet because I'm pre-diabetic, you're already building up insulin resistance. And what you might notice is that I don't wake up with the heart on like I used to, or my erections don't get as hard as they used to, because insulin resistance is happening. So it's affecting nitric oxide, so it's affecting dilation of the vessels. So you can't get good blood flow. And I'm not even a diabetic yet, but it's already happening. Insulin resistance, start noticing more fat around your gut. Got a little more belly than you used to. Anxiety and performance stress. That's happening all the time. All right? Pornography related sexual dysfunction. Obesity and inactivity. Sleep deprivation and sleep apnea. Nicotine and vaping. Low testosterone levels. Medications. All this stuff ties into it, and I'm putting it in that order. All right. The common thread is impaired nitric oxide. Everything kind of goes back to that. All right? And excessive sympathetic nervous system activation, meaning that I'm too anxious. I got too much pressure on me. Whether the cause is metabolic disease, anxiety, sleep deprivation, nicotine exposure, many of these factors ultimately reduce smooth muscle relaxation. And if the vessel doesn't relax, you ain't getting no blood flow, so you're not getting great erections. So for a man under 40 presenting with ED, this is how we start off with the screening. We want to know what your A1C is. Are you pre-diabetic? Are you diabetic? I want to know what your fasting insulin is. I might need to do a lipid profile on you. What's your blood pressure like? I want to know about your total and free testosterone levels. Your sex binding globulin. I want to know if your LH and FSH from your brain is telling the testicle to even make more testosterone. Also, do you have sleep apnea? Do you snore a lot? Is that an issue? Then there's depression, anxiety, and finally, dude, how you spending your time? Are you watching a lot of pornography? All that kind of goes into trying to figure out why this young guy is starting to have problems with erectile dysfunction. ED in young men should not automatically be dismissed as psychological. All right? For some of you, it's in your head, but we can't just make that assumption. It can be an early warning sign of future heart problems. So sometimes guys come in to see me who are younger with ED, and I treat their ED, but I also refer them to a cardiologist. Why? Because the penis has smaller vessels. I'm seeing the beginning of what's really going to be a heart problem in the future. Now, that was a lot. I'm telling you, because the thing is that we're always trying to figure out what's going on with these young guys having erectile dysfunction, and it's real. I can tell you that it's real. Now, I've said a lot. I don't know if there are questions out there, but Lisa, let me know if there's some questions out there. So the thing is, I need to really know. The question was, is that I just had my testosterone done. It was 25. I need to really see that scale to make sure I'm understanding. But even if it was 250 instead of just 25, you're still in the low area. All right. So most scales, what we're talking about is 250 up to 900. So it depends on which scale you're looking at. So when you tell me 25, I'm like, did he mean 250? So I can tell you that I'm concerned that your testosterone level is low. We want to do a full workup because you want to check the hormonal axis. You need to have a LH, a FSH, a cortisol, an LH, FSH. I need to know about your testosterone level. I need to know what your PSA is. I need all those levels together to say, okay, is anything going on with this axis? Is this primary or secondary, dysfunction of his testicles? All right. Hypogonadism is the word we're looking for. All right. Next question.
Next question, Donald asked, what unlocks the door? And that was really early on. I think that was when we were talking about insulin resistance. I think he answered that.
Yeah. Yeah. Well, the thing is that, basically, insulin gets that cell, what unlocks the door to get the energy into the cell. All right. Where we start talking about ATP and all this other kind of stuff. Insulin does that. Insulin helps that glucose get into the cell. All right. So the thing is, if the cell is insulin resistant, I'm like knocking at the door and say, hey, man, I got all this sugar in the hallway. It needs to get in there so we can form some nitric oxide and dilate up them vessels. And that sugar's just floating around out there. And it's floating around out there because it can't get into the cells. And now it's starting to stick to the red blood cells. And the red blood cells are starting to clump together and they can't flow into the other small vessels. That's why a diabetic loses a toe and then a foot because they got all this extra sugar that's just floating around there and the body can't use it. So they put you on metformin that says, hey, get rid of all that sugar. So you're pooping it out, you're peeing it out, you're trying to get all that sugar out of your system, because you're not using it. But what do? You eat more sugar. Next question. Being anemic, will it affect your erections? That's a good question. You know, I would think that, it's going to affect you from the, will being anemic affect your erections? I think it's going to affect you from the standpoint of, your energy level is not going to be there for one thing. And then the thing is that, oxygen, you don't not having enough. You got to think of red blood cells as like, box cars that are carrying oxygen and all this other kind of stuff. So indirectly, I think so. Yes. And Lisa's adding in there that iron is a building block for hormones. So over time, chronic anemia, all that affects you, because you don't have the building blocks to actually produce the hormones that you. So yes, it will affect you. I'm not understanding that. I'm having problems with everything you're saying. What are you saying? Oh, he's having problems with everything that I'm saying. Oh, I was thinking like you didn't believe what I was saying. I was like, what the hell? So the thing is that yes, yes. If you're having these problems and you're seeing all this happening, my whole talk, this whole thing is like a wake up call. Who's going to sit here and tell you all this stuff that I'm telling you? You're not going to just go find this. It's hard to get this information. Why am I having problems as a younger guy with erectile dysfunction? I'm going to tell you right now. Go to Urohard. Urohard.com. Urohard.com. Set up an appointment to see us. Let us try to help you out. We understand the problem. And I'm trying to tell you that's what we specialize in. And if it's just erectile dysfunction, we can help you with that. But if you say that, hey, I also want to be enhanced because I want to be bigger, we do that all the time. I got guys coming in from all over the country, outside of the country, that are all coming here to this office, to my private operating room, because they want to be bigger. And buddy, I'm changing the game. I'm telling you, I got to salute some of them dudes out there. I'll hook them up. So, what's another question out there, Lisa? Actually, do I come to Louisiana? Do I come to Florida? Yeah, we come to Jacksonville, Florida. Unfortunately, we don't come to Louisiana. But I got guys flying in to see me from California to Canada. So Louisiana, just bring your butt on over. We got you. We'll make it worth your while. Make the trip. I got guys flying in for cases this afternoon. So it's happening all over. Was there another question? Okay. All right. So this whole thing with men that are younger that are having erectile dysfunction, it is real and it is happening. It is multifactorial, but I can tell you one of the number one things you can do is stay active, eat well, things of that sort. Be very conscious of if your body's trying to develop diabetes, insulin resistance. All right, those are things out there that can happen. Activity, is pay attention to what your body's telling you. If you're snoring really hard, sleep apnea may be an issue. What's that? What's the next one? So, Christopher asked, was there any risk of complications with the procedure? We've probably done somewhere over 19,000 procedures. Guys are doing well. I've actually had the procedure twice when you start talking about male enhancement. The thing is that guys do well. We got a long track record of guys doing very well. So thing is go to our website, Chris. That's urohard.com. That's urohard.com. Or you can just call us, 478-225-9324. And you can talk to my nurse practitioner, Lisa, who's board certified in urology for over 20 years. You can talk to Xavier at the front desk, or you can talk to me. We got you. And we can try to help you figure out what you want to do. Trust me, we're changing the game every day.
How much does the procedure cost?
Now, somebody asked about how much does a procedure cost. We offer a lot of different things depending on what you want. But the most interesting procedure that guys talk about is male enhancement. If you're trying to just make the shaft bigger, then that's $79.50. If you're just trying to make the head bigger, then that's $3,500. But if you're trying to make the shaft and the head bigger together, then that's $99.50. Right there at $10,000. I'm like, you're like, oh my God, $10,000. Well, guy, listen. What we do is no surgery, no cutting, it's painless, go home same day, back at work the next day, and permanent for life. So when you come and do this, it's permanent for life. And the thing is that, we guarantee you that you're going to be bigger. Now, if you can't just say, I'm going to go get that money from, out the drawer or whatever, we got financing programs. You put down $1,000 and we'll help you finance the rest. So there are ways to get it done. We meet you where you're at. But understand this, don't suffer in silence. Call us. We got ways to make this happen. We can get you done. All right? Okay. All right. So Daryl was asking about, things pertaining to erectile dysfunction. He's had wave therapy and PRP, which both work. Hopefully they did them at the same time, because wave therapy is basically, sending in a wave that breaks down the vessels and then they try to heal and replace themselves. PRP is going to help them out with actually healing. So if you do them together, they can work synergistically, So thing is that I don't know if they got you using a vacuum pump or whatever, but understand this. If you're not using a vacuum pump, then you missed out on a super benefit. And I've had guys that have had things done like that, and initially they saw nothing. But I kept encouraging them to continue to use the vacuum pump, and next thing you know, those blood vessels became more and more reactive. But you got to make sure that it's just not this problem, So, if you got other problems out there, like diabetes uncontrolled, hypertension, all this increased cholesterol. If you got all these other problems, then when we try to build a house, you're tearing it down. So you can't just look at just say, "Oh, it didn't work for me." Well, the thing is what else are you doing? So it becomes more of a holistic approach when I'm trying to help guys out with erectile dysfunction, because I got to figure out why. Why do you have erectile dysfunction? And then try to stop you from doing what is causing your erectile dysfunction. All right. So I got to make it real enough to you that you understand that, hey, I got to stop doing this because I'm getting an end result over here where I'm having erectile dysfunction. So the thing is that even if I fix this, it's going to be temporary or it's not going to work at all if you don't fix that. It's like dominoes, man. They just keep falling. And if we don't get you to change the pattern over here, then your pattern is just going to get worse over here. All right. Okay, somebody asked to remove scar tissue on the shaft. That becomes an individual thing that really comes down to a physical exam. So, if you're somebody who's pretty serious about that, what I'm going to suggest is call the office, 478-225-9324. Have a consultation with us. And then from there, we'll start off with just pictures to see what you're talking about so we can understand what's actually going on. You'll send that to our electronic medical records. Then we'll evaluate it and say, okay, this is what we can and can't do for you. So we can be realistic, about what we can actually help you with. But understand this, I'm a penile surgeon. I got a private operating room. I'm pretty sure what you got going on I can help you with, but I need to see it. So before I commit myself. All right. Did I answer all that question?
What's your thoughts on Trimix?
The second question was, what was my thoughts on Trimix? Trimix works. It works. But understand this. Every doctor has their own formula. All right. So the thing is, I know my formula is a very strong formula because I'm usually the end of the line guy. I'm the guy when all the other stuff has failed. Now you coming to see me. You've been to your primary care doctor, you couldn't get into the urologist, or you went there, you weren't happy, and then you finally decide, I'm going to go see this guy I see out here on social media. So usually when guys walk in my office, I'm dealing with, tougher cases. Yes, so does Trimix work? Yes, it does. But there's a bimix, there's bimix, there's a trimix, there's a quad mix, so we can get stronger and stronger. But as you get stronger and stronger, you're getting closer and closer to the end of the line of what's really happening with this tissue, because those medications are a chemical erection, meaning yes, I inject it directly into the penis. You say, "Oh my God, inject into the penis?" Yeah. It's a shot, but the needle is as small as a strand of hair. So I can inject this medication, and now you get erection in the last 1 to 2 hours. I mean, that's a game changer. When you start off with no erection at all, I haven't had erection in 5 years, 10 years, and now I got erection that lasts 1 to 2 hours. Especially if I start doing other things that's going to improve the tissue. All right, because basically I'm rehabbing the penis and I'm helping you get better erections. Dude, I changed the game. That's what I do. All right, what else? Actually, at this point, we don't offer any temporary fillers. Our filler is a permanent filler. So when you come to see us, it's permanent. Our filler is a biostimulant. It's going to cause your body to make its own natural collagen. So the filler will dissipate, but what you got left is your natural tissue, natural collagen. That's your size for life. So once I make you bigger, I don't care if you gain weight, lose weight, get shorter, taller, that's your size for the rest of your life. Gonna make you bigger, buddy. Hold on to it for a lifetime. Okay, so somebody out there said, "Hey, I'm having problems with ejaculation." Well, is it that you can't ejaculate? Is that what you're saying the problem is? I'm not quite clear when you say I'm having problems with, or I can't ejaculate, but it takes me a long time. You know, So you have to look into that. If you got a guy who says I'm having problems with ejaculation,
because he can't.
he can't ejaculate. All right. Then the thing is that actually becomes urology workup. All right, because I know that the ejaculatory fluid is created in the prostate and the seminal vesicles. So, you might have to have, if I was doing a urology workup, you might have to have some like a transrectal ultrasound and see what's going on. Do you have obstructed ejaculatory ducts and all this other kind of stuff? So, meaning I can't get it out. So I see these big old seminal vesicles down there. The question is, do I need to do some unroofing or whatever to try to see where the level of obstruction is, why you cannot ejaculate? Or what you're saying is that I could have sex and on and on and on, and I just can't ejaculate. That means you're not obstructed. You're just not reaching a climax. Then I want to know stuff like, okay, are you taking any certain medications, any anxiety medications that keep you over in the parasympathetic side of the autonomic system instead of the sympathetic side? So it becomes more of a dive of trying to understand what's going on with you, so we can figure out what we need to do. So this whole thing of I'm not being able to ejaculate becomes a full doctor's workup. That's the short answer. Okay, I don't use PMMA. All right, so the thing is that now I've had guys come to me who've had it done with PMMA, and then I can actually still use our filler, but we're always conscious of what you've had done before, but we don't use that. We have a different formula. Okay, all right. So I'm gonna repeat that question. What you're saying is that you've had bladder cancer in the past and several TURBTs, that's transurethral resection of bladder tumor, TURBT, and now you've got some scarring. That means there's probably scarring inside of the urethra itself. All right. So when you say scarring in my penis, you mean scarring inside of the peen channel of the penis. Then the thing it becomes, that you get these dry ejaculations. Okay, so when they actually did, the resection of the tumor, was there any tumor at the bladder neck itself? All right. So you go in there and you resect this tumor, and you're trying to do good cancer surgery. If they did anything to affect the bladder neck, then the bladder neck could actually be open. So now when you ejaculate, and that bulbar cavernosum muscles does that feeling that you get when you ejaculate, like all right, it's that squeezing down there because it's trying to shoot it out. But instead, with the pressure, because the bladder neck is open, it shoots backwards into the bladder. So you say, I felt like I came, but nothing came out. Well, you did come, it just went retrograde ejaculation. Now, I'm not your doctor, and I haven't examined you. All that would really take a full workup. I'd have to do a cystoscopy and everything like that to figure out what's going on. This whole thing with dry ejaculation, if what I'm saying fits your case, there are medications that you can take. I don't really recommend all that unless you're trying to, have a child or whatever. There are other things that they can do to get the sperm out of the urine, after you've ejaculated and stuff like that. But if you're at an age where you're not trying to have kids, then it probably possibly is not worth it to go through all of that. Now, if they injured your urethra from all the TURBTs of passing that scope back and forth, then you got to make sure the urethral scarring is not causing you a problem also. So there's a lot to be said about that. That becomes a full workup with a urologist.
He says his doctor suggests that he takes Sudafed.
Sudafed that's the one I talked about medications, because what Sudafed is going to do is going to tighten up the bladder neck. All right? Because what you're trying to do is keep from having the ejaculate going backwards into the bladder instead of coming out through the penis. So you take the Sudafed, but also Sudafed raises your blood pressure. So And Sudafed can cause problems with erections too.
Daryl wants to know what's the cost for an office visit.
Well, Daryl wants to know what's the cost for an office visit. If you just want to talk to us about actually, male enhancement, that's a free consultation. Just call us 478 225 9324. Now, if it turns out that you want to just focus on erectile dysfunction, that's a full doctor's appointment. That starts off at $200 for the initial consultation. And then we got to figure out what we got to do for you. All right. So the thing is that, it just depends. Now, if you come to us and we made you bigger and you say, well, doc, I'm bigger now, but I also want to improve my erections. Well, you're already in our system. There's no consultation fee at that point. So what we got to do, we just figure out what we need to do next as far as a procedure or whatever we got to do to improve your erections. So that's how it works. So the first thing you do is call us. Just call us 478 225 9324. Okay. All right. So this patient is asking about decrease in ejaculation volume. All right. There could be several things going on there. You could also be somebody with the open bladder neck. This could be diabetes that's causing that. There are a lot of different things that can affect your ejaculation volume. You could have obstruction itself. So all of that kind of goes into this whole thing of figuring out what's the source of your decrease in ejaculation volume. So that becomes a little bit more of a complicated question, and you got to figure out which pathway you got to go down to figure out what's really going on with that particular person. So the thing is that you need a doctor's workup. But you got to ask yourself, am I still trying to have kids? And you're like, well, no. Then do you have good erections? Oh, yes, I get great erections. It's just I don't get a lot of ejaculation volume. Okay, well, ejaculation volume at that point is for fun. So the thing is that, yeah, I want to see it come out. Crazy story. I had a guy who actually had a very big prostate. He's getting up several times a night and all this other kind of stuff. And the thing was, I told him, I said, well, we can improve your peeing if we resect your prostate, a TURP, transurethral resection of prostate. And I told him the side effects is some of it you can get retrograde ejaculation, which will decrease your ejaculation volume, or you might not get any out at all because I resected that prostate. So the thing was is that he was like, oh no, this guy was like late 60s, 70s. He said, my wife and I like to see it come out. It's important to us. Totally respect that. Glad I discussed it with you on the front end so you can make sure that you understand that's a side effect, that particular type of surgery. But this guy was also my buddy. We was out on a hunting trip and we were roommates on the hunt trips. And the thing was is that, this dude was getting up like every hour on the hour to pee. And I'm like, what the hell? I say, dude, let me go sleep on the couch. Because you keep going in and out the room. We're at this hunting lodge and I can't sleep because you keep waking me up. So I went and got on the couch and I said, look, you're not resting because you're up all night because you can't empty your bladder. So you get a little bit out. You got to get back up. Get a little bit out. You got to get back up. You get a little bit. All that because you're concerned about how much sperm comes out when you ejaculate. Sure enough, he came to me later. I opened up his prostate and now he's getting full night rest. That's how the story goes. But that was a side story. All right, next question. Okay, you're my best friend. Can it go back to
will it revert?
Oh, somebody wanted to know, will it revert? It depends on what type of filler you get or what type of procedure you have. With us, our results are permanent. So once we make you bigger, that's your size. All right. So the thing is that, we're adamant about that. So we take measurements. We want to know what your measurements were before the procedure. Then we take measurements after the procedure. Then the thing is that if you come back and you tell us it has shrunk, I got measurements. You picked up, so we know, because a lot of times it gets to this thing of visualization. You get used to seeing your size. You're like, man, he don't look as big today as he did yesterday. I mean, it could be the penis. Yeah, we talked about cremaster reflex and the penis how it can draw up and all this other kind. So the genitalia is constantly changing size and all that realistically. But the question is, did I really lose size? With our formula, no, you don't lose size. Short answer, you don't lose size. It's permanent. So I guess we're getting to the end of the questions. Man, dude, this whole conversation, I can tell you about why younger men are getting ED more than ever. I knew it was going to be a lot. A lot of your questions were not down that line. We got talking about ejaculations and stuff like that. But I can tell you this whole thing is that younger men are getting more ED now than ever. And the number one thing you can do is pay attention to how you're eating and you're exercising. Lisa, did you have something before I'm breaking this down? Okay, all right. Well, for those out there on TikTok, you got disconnected. That's not a problem because we're wrapping it up. All right. So I can tell you, when we have these conversations, we're trying to destigmatize male enhancement, erectile dysfunction. So please like and share. Go out there and follow us on our YouTube page, and you can see these talks and check us out on our podcast. We're on all the different podcast levels, so we're growing there also. You can watch. These lives are being shown on TikTok, Instagram, and things of that sort. So you can go watch a lot of that stuff there. But if you want the full show, you got to go somewhere to like YouTube or podcast or whatever. So we got a lot of information out there that guys want to know, and they have nowhere to go get it. And hey, guys, if you really want to make a difference and you want to change your lifestyle and you want to change your confidence level, come and see us. Because what we're going to do, we're going to keep them horns up.